Broadcasting from the business capital of the world, this is the Podcast Business News Network. Hello, everybody. Hello, and welcome to the show. I am Ross Morasso, and my guest today, Sue Woodriffe out of Portsmouth, UK. Now, she runs a practice that deals with, I'll call it alternative therapies. They can be physical, they can be social and emotional. Some of you may have heard some of these names we'll talk about today, like the Boeing technique or the blast technique, and many more of us will not. And Sue has been with us on the show before, and I feel as though we barely scratched the surface. So I'm very happy to have her back. Sue, welcome back.
Thank you very much. Nice to be here.
Sure. So first, I want to say that you can find Sue at suewoodriffe.co.uk. And so Woodriffe is spelled W-O-O-D, but then it's R-I-F-F-E. So for those of us tuning in for the first time, give us an overview of how you work with your clients and some of the options that they can explore if they need services from you.
Okay. Well, as you say, I do the Bowen technique, but that's hands-on. So unless you're local to me, it's not going to happen. But it doesn't mean that you might not want to go to another Bowen practitioner if you can find one, because I'm not the only person that does it. So I'm quite happy to be an ambassador for it because it's so brilliant. But also I work with at emotional level. I do a lot of trauma work, phobia work, and anxiety, depression. And for that, the two tools I use for that, if you like, are EFT, which is tapping, and blast, which is the eye movement, an eye movement modality that came out of EDMR, which came out of NLP, which came out of, I don't know where they found it, but there's never anything new in the world.
You know, this is a clumsy way to ask this question, I guess, but what would have to be wrong with us to need that for some of these techniques to maybe be helpful?
I don't ever think we're wrong. I think our bodies speak to us, so we can always learn from it. But for the Bowen, it would be more the physical, more likely to be a physical, sciatica, bad knee, bad shoulder, whatever, stiff neck. But the emotional stuff is we all carry emotional baggage, and we all carry beliefs actually that don't always serve us. We pick them up when we're young, and then maybe when they're older they don't serve us, and they play out in strange ways in our lives. So I do a lot of belief work with people as well, and when we find they've got beliefs running that aren't helping them anymore, we can change those beliefs. But also, as I said, trauma, particularly I work with trauma, a lot of trauma work.
Let's the belief one. This is interesting because that strikes me as something that has the capacity to be, much more sinister in our lives, meaning that it's there, but it's probably for most of us, we're not nearly as present to, as opposed to a tweaked nerve in our back, which we are very clear that exists, right? But how our belief systems might be A, limiting us, or B, causing us harm, even at a small level on day to day. Do you have an example of how that might play out for some people?
Well, I can talk about one that I discovered that was one of mine, because that was, I don't want to really talk about other people, but common beliefs that everybody runs to some degree is I'm not good enough, or a lot of people run I'm not loved, but I ran a very specific belief that I'm not big enough and strong enough, which arose from the fact that I had a brother who was 3 years and 4 months older than me. And from a very young age, I desperately tried to keep up with him. And of course, I couldn't. So I always felt I was never big enough or strong enough, because I couldn't reach the lower branch of the tree. I couldn't climb up onto the wall. I couldn't ride my bike as fast. And it became a thing. And then I didn't even realize it was running through my life until I started doing this work. And that belief that I'm not big enough and strong enough kept me small. It made me unlikely to step out, unlikely to try things, because I'm not big enough and strong enough. And when I shifted that's why I'm here today. A few years ago, I wouldn't have dreamt of doing a podcast with somebody. I'd have been too frightened, because I was not big enough and strong enough to do these things. And we shift the beliefs, then our lives change.
That's interesting, because you're talking about, from something you did as an adolescent, right? 6, 7 years old or whatever, you're just a little kid, and was localized to just some, physical exercises or, family competitions, but then gets all the way into now even to public speaking in your adult life.
Yes. this is what happens. And one of my favorite quotes comes from Carl Jung. He said that while things remain in our unconscious, they manifest just in our world, and they manifest in our world as fate. So our unconscious beliefs, they manifest in our world. If you run, I'm unlovable, you're going to find it very hard to be in a relationship with anybody because that's going to keep coming through. I'm unlovable, and you're going to do things to
Mm.
make it come true. It's not conscious. It's not conscious, and that's why people don't realize what's happening. But that's when you get recurrent patterns in people's lives, and that's when they might come to a practitioner like me.
Do you sometimes work with clients who will come to you and say, I'm not exactly sure what it is. I just feel like I keep making the right choices in my life, but things are not working out. And then you can work with them sort of over a period of time to uncover what might be causing interruptions that they're not, that's not
I,
beneficial to them.
I'd love it if most of the people that came with to me had that awareness to start with, but a lot of them don't. They come and they say, uh, "I, I, my relationship, I keep having my relationships keep breaking down, or my job isn't going as well as I thought it should be, or I didn't get the promotion, or I haven't. It's those I haven't got the good relationship with my child, or I'm depressed, or I'm anxious. It'll go back to why. What's running in your life? And part of that work will be what beliefs did you take on when you were very young? What beliefs did you take on that aren't serving you? Some of them will. If you grow up believing I'm loved, keep that one. Why would we want to change that? But if you grow up believing that you're, as you said, as I grew up believing I wasn't big enough and strong enough to do things, it's spilled out into my life.
I heard somebody say to me once, and I found it to be very profound, especially because of how I think it would probably cause so many arguments out there in the world. But the statement was, as soon as you believe something, you can no longer trust it. And I found, of course, it's very ironic, right? Because beliefs just seem to be the one thing that we trust
Yes,
blindly, right?
yes,
But of
yes,
course, that's why you say you can't trust it. We're no longer open to what I got out of that. We're no longer open to new data, and that's how we become
yes,
closed-minded blowhards, right? Um,
yes,
so people come to you, and you're hitting on a couple of things here. So if people are coming to you because they're recognizing these problems in their life, but it's not
yes.
a hurt knee or a
Mm,
bad hip, what
mm,
you have these techniques listed out on your website. And
mm.
I realize that it may go much farther than that, but like, how do some of these play in when you're working with people when they come to you? What should they expect? Are you just having a conversation? Are you lighting a candle and sticking it on the top of their head and telling them not to move? Right? Like,
I'm having, I'm often having a conversation, and we're often tapping. I've told you about the EFT tapping. We often tap while we talk
we
because
didn't talk
that
about
does,
it
and
this
that,
show, so briefly explain that again.
okay. But tapping is EFT tapping, emotional freedom technique. We tap on, it's mostly around the head and upper body. We tap on points that are actually meridian points. If you know anything about Chinese medicine and the meridians that run through the body, we're tapping on those specific points. So the inside of the eyebrow, outside of the eyebrow, just under the cheek, just under the nose. There's a download on my website that you can see all the tapping points. When we tap and we talk, things do come up from the unconscious, and also the way people talk and the things they say, it becomes apparent. So I had a client recently who came to me who had a really difficult childhood and has had a very difficult life, and it became very apparent when we were talking to her that she was running a belief that it couldn't change. Nothing could change for her because so many bad things had happened to her. How could it possibly change? So
Hmm.
then we started looking at that belief, where it came from, and I did something with her, and I gave her a homework to do to practice to start to shift that belief. Because if she believes that, no amount of work with me will really change anything. If she believes it can't, or she can't change.
And has she made progress?
Well, I've only seen her once.
Okay, so you're
So
just
she's
starting on
only
the
just
journey.
came, but I'm just giving you that as a for instance. But I have met that before. But I can't people. I can't heal. I can't get better. Nothing can change. Everything's going to stay the same. Nothing works for me.
Yeah.
A lot of people come in with that, and that's one of the first things that I try and address with people. If there's not an immediate trauma that I have to work with. So
It's something
um,
that I tell my own children is often, whether you think you can or you think you can't, you're right.
yes,
And so do you find that on our path to wellness, and we'll talk about the word wellness here in a
Mm.
bit, do you find on our path to wellness that if you don't have a mindset that think can be, that you can be well as a whole and everything else? Like, I guess what I'm saying is, do you think if our mindset is not right, everything else that you could be doing in the medical community or therapy or everything is severely handicapped?
I think by and large that's true. If we're not in alignment with what we're trying to achieve in any field of life, it doesn't go as well, or it doesn't go at all.
When
I
we
think I
first,
think that's
oh, go ahead.
yeah, I think that's true. Yes, so that would apply equally to if we aren't in alignment with keeping ourselves healthy or making ourselves healthy, and some part of us is hanging back from that or not believing it or sabotaging or whatever it is, and it's all unconscious. We don't do it consciously. So it's not blame. I'm not blaming people for it. I just know it happens, and I know that's something I look for, work with, and address when they come to me.
When we first connected with each other before we started our show, or a couple months before our show, as is a natural, common, customary courtesy, you said, "How are you?" Right? And I responded with, "I'm doing great." But at that moment, I seemed to think when I said that, I started to wonder or started to notice that, maybe 3 days ago, I might not have authentically answered it that way. But of course, nothing specific came to my mind as to why I'm doing
Mm,
great today and not doing great tomorrow. And so this brings up this conversation and this concept of wellness. And there's many components of it and versions, especially from the people that we count on, who have definitions of what being well means. So
mm.
first, let me start with, what do you think being well means?
We talked about a little bit about this last time, didn't we? And we looked at about part of being well is being to be okay where you are. If you've got problems or issues that are intractable because you've got a health condition that's like the surgeries I had on my knees make my life difficult, I have to be okay with that. I can't undo the surgery. But beyond that, there are things I can do to make sure I'm well and healthy and happy. So I make sure I get good sleep. I make sure I drink water. I do my best to eat well. Don't always manage that because our relationship with food is a whole nother conversation. But on the
Mm,
whole, I try to eat fairly well. Um, I stay off. I don't drink. I never did drink very much, and I stopped completely when I was first pregnant, and I just never went back to it. But I was never a drinker. I was a smoker years ago. I stopped smoking. So there are things that we can, and I've never taken, never, it's a long time. Since my teens, I've never taken a recreational drug.
mm.
So I think there are all those things that we can do to make sure that will keep us in good condition, and keep our bodies and our minds. We do a lot to keep our bodies in condition, but I don't think we actually very often attend to our minds and our mindsets, which is part of wellness. So if we're upset, tapping, I use tapping a lot. You can tap out your difficult emotions or pains. I went to a funeral this morning and I was quite upset when I came back because it was a lady I'd known all my life. So I came home and I tapped on the grief. And now I'm here and I'm fine. And I'm talking to you and I really am. I'm okay. But if you caught me the minute I was coming in the door just after the funeral, I wasn't okay. I wouldn't have been having this conversation. Does that make sense? And so it's dealing with things at the moment.
What one of the things I'm hearing you say is that wellness is something that we, need to be vigilant about or to be acceptant of, that
Mm.
not in every instance will we necessarily be well, and that's okay. Um, when
Again, that comes back to our definition, doesn't it?
right.
Most people's definition of wellness means they can move around freely. But my definition of wellness has had to be different to that because my definition of wellness can't include that because I can't do that. That's what I mean by being okay with it. But I'm still well in myself. I'm still happy. I'm still working. I'm still loving my job. I still see my family. I do. And I'm in generally good health. I very rarely become have a cold or anything. I'm in good nick.
For those of us who've just who tuned in or missed us at the very beginning of the show, my guest today is Sue Woodriffe. You can find her at suewoodriffe.co.uk. and Woodriffe is Riffe. And she runs a practice out of Portsmouth, UK, where depending on the therapy or what you need to do for your life, you might have to be with her. But there are some things that she can do virtually with you. And she has all sorts of alternative healing and therapeutic techniques. And that's what we're talking about now. We're in the middle of a conversation about wellness and what does wellness really mean. And so, Sue, as you're talking about these things, I'm thinking about how when I go to the doctor, whether it's for an annual physical or if I have an ailment, and often when we're checking in, we'll get a questionnaire, rate your pain or these yes or no's. Some of it's just standard health history, which can be maybe be beneficial. But what I notice is that rarely do these questions ask me how much stress or anxiety I have in my life. Do I like my job? Am I happy in my marriage or my romantic life? How robust are my friendships, right? It's always about, can I walk up 2 flights of stairs? And I wonder if there's not a missing there with traditional medicine.
I think there is a missing there because I think a traditional medicine, and I can't talk about how it functions in the States, but I know how our national health system works. But sadly, it focuses on illness, and there's very little in it about wellness. So you go to the doctor because there's something wrong, and they do something. They might send you to a physiotherapist or give you a tablet or tell you you've got to have a surgery. But they don't ever say to you, and when you've done that, you can keep yourself in good shape by attending to your diet, your sleep, your water intake, your mindset. We don't ever hear that from within the medical profession, in my experience.
I've actually heard friends over time, or even you can hear comedians using it as a punchline about how the doctors are just, riding me to stop drinking or smoking or to, eat more fruits and vegetables and lay off the Doritos and so on and so forth. And I wonder if we haven't, and the United States is not that much different than the UK, right? In terms of like our societies, the way we live, we all have the Western diets and sort of social aspects that we have. And, I wonder if some of us have actually hold a belief down low or just a way of thinking where we're now holding people in contempt for wanting to help us. That there's just a governing resistance there because we're just so resistant ourselves to actually making the correct choices. And so inside of wellness, how often as you start to, and I've said this other times on various shows, when you start working with a client of yours and you're peeling back the layers of the onion, right? How often along in those layers do you find that we as human beings, and this is just in your experience and what you're noticing with your people, do you find that a lot of the barriers is our own personal resistance that we're bringing to the table?
Resistance is an interesting word, isn't it?
Yeah.
Do we resist, or is there something going on that makes us unable to, or not willing to, or usually there can be just resistance. There can just be that small child stamping their feet, going, "Don't you dare tell me what to do." There is that, and you can meet that definitely, but you can also meet resistance in that somebody doesn't feel safe enough to change or to look at something. And that's not a resistance in the same sense. It's a lack of safety. And my job is to create safety so that I can ease people into looking at these things. But yes, you do get that straightforward. I'm going to stamp till I go blue in the face and you're not going to make me do anything.
Well, I think it's in how I meant resistance, and we can pick other words, but just so we're defining it right, the way I was meaning it also applies to what you're saying, because when you talk about our belief systems, right, that would be something that you start getting rid of your beliefs. I would imagine that commonly, at least for a period of time, there could be a profound sense of discomfort, right? Because our belief systems are what we thought about the world.
Yes.
We can't rely on that anymore. And so that when I see resistance too, like of letting go and that sort of thing.
Yes. Yeah, absolutely. That's what I mean about not being safe to do it. We're looking at two sides of the same coin there, I think. Yeah, because it can be scary for anyone. Of course it is.
I know that, look, and everybody's different. And if there's one thing I'm hearing from the way our conversation has gone so far is that you're there for your client, right? And regardless,
Absolutely.
right? And regardless of what it is you might think they should be doing, it's about where we're at now and what we're
Yes.
focusing on.
Yes.
Let me, if I could give you though, on a generally as a rate of one being don't worry about it, or 10 being this should be the first thing we go with, dealing with emotional freedom, dealing with
Yes.
identifying our belief systems.
Mm,
One, we'll deal with that when we get to it, or 10 being, you know, I don't care how bad your knees are. If we deal
mm.
with this first, like where do
Mm.
you feel like it fits in, I guess, is what I'm asking, in importance on our path to wellness? And again, this is just your experience, right? So I know you don't have to speak for all of Earth.
I'm not sure there's an answer to that because everybody's different,
Mm.
and everybody, what might be a 10 for one person might be a 6 or a 3 for someone else, in terms of what's best for them to look, what's priority for them.
I respect
So I'm
that
sorry,
answer.
it's
No, it's
not
not.
very
It's a good
clear.
answer, I think, because depending on who we are and what our
Mm,
communities are and things like that, we come to the table sometimes expecting it to go a certain way,
yes.
right?
Mm,
Let me ask you, because we so for those of us listening, right? So some of these techniques, the Bowen technique we've talked about, you last time, you briefly talked about today. Um, you also have this emotional freedom technique, EFT, the blast technique, and then this other phrase that's on your website, and maybe it's something we've been talking about. You talk about the meta consciousness.
Meta consciousness is a whole different thing where we look at very specifically at the emotional root cause behind a problem in the body. And that's a whole conversation, but it came out of, again, everything has a history. It came from Dr. Hammer in German New Medicine. And he started it all off when he himself got testicular cancer, and he got it shortly after his son died.
Mm.
And then he started noticing people coming into his surgery with testicular or ovarian cancer. And when he started talking to them, he started to find out that they had a loss or a grief, a recent loss or grief. And he started to look at this mind body connection in that way, and the whole thing has grown from there massively. And we now there are whole directories to which I have access where I can look up and see with a particular tissue what kind of um, experience or trauma might have caused that particular disease.
And cancer is a good one, right? Because knee, like that's a good example, because let's just say I keep referring to my knee, but I could just say I fell and twisted my knee, right? Like we have that ouch moment that we can
Yes.
specifically identify,
Mm,
even though our
mm,
ouch moment may not actually be the whole meta
mm.
consciousness sort of
Yes. Yeah.
story of it. But with cancer, outside of somebody smoking 2 packs a day and getting lung
Mm,
cancer,
mm.
we can start to run out of things to point to real quick, right? Of why
Yes.
they may have gotten it.
Yes.
And to be fair, some people, children get cancer, things like this, like the reasons are different. Sometimes it's genetic, but I think, anyone who has cancer has one thing on their mind. How do I beat this? Right.
Mm, mm.
And so you mentioned cancer here. If you were to get it, you now have it, right? And then now
Mm,
our the path for somebody who has something like a cancer, the destination is unknown. And
mm,
statistics this, statistics that, but people always beat
mm,
the odds.
mm.
So have you worked with cancer patients?
I've worked with cancer patients, but the cancer patients I've worked with have elected to go through the traditional
Mm-hmm.
radiotherapy, and I have journeyed through that with people, and they generally do very well they're having my support and we're working through the issues as they come along. That can be an easier experience for them. My teacher in meta consciousness, I know, has been doing this for a long time, has worked with people who have healed themselves of cancer without any intervention. She's actually literally seen tumors grow and tumors shrink in front of her eyes
With
because she's working with she's very good at honing in on the very specific. issue.
So for me personally, from what I've seen out in the world, I think that we can communicate with our bodies, mind, body, and spirit at levels much more specific and profound than modern science has actually been able to identify.
Yes.
Right. So what you're saying that the founder of Meta consciousness, let's always throw that extra word in there because we're definitely not talking about Mark Zuckerberg. So
no, we're talking about meta consciousness. Yeah.
Yes, meta consciousness, that no medication, no pills, no chemotherapy, etc. And people have, in essence,
healed themselves.
Yeah, like talk themselves. And it's not just talking yourselves through, that would probably be a very incomplete picture, but through body and communicating with the body and diet and exercise or rest, whatever else they used.
But the main thing is that what she's found is the actual shock moment that set that biological process. Because from the meta consciousness point of view, our bodies are always trying to communicate with us. They're always trying to help to us. There's always a biological reason behind how the disease or dis-ease has manifested in the body.
I've heard this phrase dis-ease, and I've seen it spelled DIS-ease. Is that how you mean it?
Yes. A disease or dis-ease. The body is in a state of dis-ease, but actually it's because it's biologically trying to do something. It's trying to biologically cope with an issue, and that can manifest as various things. It can manifest in bone thinning or osteoporosis or cancers or sinusitis or many things.
Anyone can hear what you're saying and take it however they want. What I'm hearing and like how it's landing on me as you're talking about this is frankly a warning that if you go through anything traumatic, to just sit there and say, oh, it didn't affect me. Like I'm being warned right now. You better be careful about that. And it seems like anytime there has been trauma, specifically social and emotional trauma, that engaging in some therapy, even if it's just a check-in, even if I don't think that something is really bad or I handled it well, I can't take that chance.
It's as well to check. But again, not everybody needs trauma treatment after trauma. 25% of people, actually, it makes them stronger and they're fine and they never did anything. But some people, it does hit them more. And we know how much it hits us and what of a shock it's been and how well we processed it. But it also depends on whether we're alone at the time. If we're amongst loving family when something bad happens to us, it can be less of an issue than if you're standing alone in a doctor's surgery and the doctor says, you've got a life-threatening illness. But if you're there with your partner and your family, it's not easier, but you're held more. It's easier to process it.
Sue, we are just about out of time, and I think we're going to do to ourselves what we did last time, which is open up a can of worms that I'm very happy that we've opened. But I welcome you back to the show whenever you'd like to come, and we can continue this conversation. I find what we're talking about to be very profound. Thank you very much for being here.
My pleasure. Thank you.
And you can find Sue Woodriffe at suewoodriffe.co.uk with last name spelled Riffe, based out of UK Portsmouth. And then do you have a phone number real quick if people want to call you, or is it on your website?
It's on my website.
Okay. Not everything that Sue can do that can help you needs to be directly in the UK. So she's worth looking up, have the conversation. So again, thank you, Sue. And thank you all for joining us. I am Ross Morasso. Until next time.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, I mean, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
Mortgage-free, fully adaptive, handicap-accessible house. And there's no catch.
It'll be our very first home that we've ever owned.
This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.